Hi, my name is Emanuel Cruz Carrasco. I'm going to read chapters 18 and 19 of the textbook Professional English Used in Medicine. Chapter 18 is the endocrine system and chapter 19 is the eye. A. Excess and deficiency. An excess too much or a deficiency too little of circulating hormones causes a wide range of medical conditions, for example, hyperthyroidism and hypothyroidism. Where there is an excess of hormone, one form of treatment consists of giving the patient something which inhibits the production of that hormone, as in the use of carbimazole to treat hyperthyroidism. When a hormone is deficient, treatment may be by replacement therapy. For example, injections of insulin in the treatment of type 1 diabetes. Doctors say sufferers of type 1 diabetes are deficient in insulin. B. Negative feedback systems. TRH, thyrotrophin releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid stimulating hormone, in the pituitary. 2. TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4 thyroxine and T3 triiodothyronine, and also to release stored hormone, producing increased plasma levels of T4 and T3. 3. T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion. If we have an illustration of this process. Sorry for the illustration being mirrored in the video. Hypothalamus, TSH, thyroid, peripheral conversion, T3, triiodothyronine, T4, thyroxine, peripheral tissues that lead to tissue actions, the negative feedback loop, and the pituitary. Those are the words in the illustration. C. Goitre. A large thyroid gland is called a goitre. The enlargement may be diffuse, involving most of the gland, or localized, limited to a particular area, as in a solitary, single nodule. The increased blood flow in diffuse enlargement, for example in Graves' disease, may give rise to a palpable thrill, vibration felt with the hand, and an audible bruit. Noise heard through a stethoscope over the gland. D. A letter of referral. Mrs. Davis' doctor has referred her to an endocrinologist. Dear doctor, I would be grateful if you would see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She describes herself as overactive, and at first she thought the weight loss was due to this, but more recently she has developed palpitations, diarrhea, and heat intolerance. She has noticed that her hands have a tendency to shake. Her symptoms suggested hyperthyroidism, and this was confirmed by an examination, which revealed an enlarged thyroid, red sweaty palms, and a fine tremor of the hands. Now I'm going to read the definition of some of the words in the letter of referral that Mrs. Davis' doctor sent to the endocrinologist. Overactive, more active than usual. Overactive, more active than is usual. Palpitations, awareness of rapid or irregular heartbeat. Heat intolerance, inability to cope with high temperatures. Fine tremor, very slight involuntary movements. Now I'm going to read the exercises of chapter 18, the endocrine system. 18.1. Complete the table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, inhibit. Noun, inhibition. Verb, produce. noun production. Verb release, noun release. Verb replace, noun replace. Verb secrete, noun secretion. Verb stimulate, noun stimulation. 18.1. Complete the passage from a textbook using the illustration and your own knowledge. Look at P opposite to help you. Pulses of GnRH, gonadotrophin releasing hormone, are released from the hypothalamus and pituitary. LH and FSH secrete from the pituitary. LH triggers testosterone production from Leydig cells of the testes. Testosterone feeds back on the hypothalamus pituitary to inhibit GnRH production. FSH triggers the Sertoli cells in the seminiferous tubules to release mature sperm and the inhibins A and B. Inhibin causes feedback on the pituitary to decrease FSH production. Here you have the illustration. Now I'm going to read the words from the illustration. Again, sorry for the illustration being mirrored in the video. Here you have hypothalamus, secondary sexual characteristics, GnRH, LH, FSH, testosterone, sperm, testes, inhibin pituitary. 18.3. Complete the sentences. Look at A and C opposite to help you. 1. A diffuse change affects many parts of an organ or gland. 2. A localized change affects only one part. 3. His diet is deficient in iron. He doesn't get enough iron. 4. Excess T3 and T4 increase the basal metabolic rate. 18.4. Match Mrs. Davis' symptoms 1 through 7 with the questions her doctor asked. A through G. Look at the opposite to help you. The first question is: are your bowels normal? The symptom is diarrhea. The second question is: what is your appetite like? The symptom is eating more. The third question is: do you prefer hot weather or cold? The symptom is heat intolerance. The fourth question is: are you able to sit and relax? The symptom is overactivity. The fifth question is: have you ever felt your heart beating rapidly or irregularly? The symptom is palpitations. The sixth question is your weight steady? The symptom is weight loss. The seventh question is: do your hands shake? The symptom is tremor. Now I'm going to read chapter 19, the eye. A. Parts of the eye. Here we have a photo of the eye, and here are the parts. If we have the eyebrow, the eyelid, the iris, the eyelashes, and the pupil. B. Examination of the eye. Here is an extract from a textbook description of how to examine the eye. Look for squint, strabismus, drooping of the upper lid, ptosis, or oscillation of the eyes, nystagmus. In lilac, the upper eyelid moves irregularly instead of smoothly when the patient is asked to look down. Next, examine the pupils and note whether they are equal in size. They are regular in outline, evenly circular. They are abnormally dilated, large, or constricted, small. They react normally to light and accommodation, focus on near objects. To test the reaction to accommodation, ask the patient to look into the distance, hold your finger in front of their nose, and ask the patient to look at it. The eyes should come together or converge, and the pupils should constrict as the patient looks at the finger. Check also for cataract, opacity of the lens. See retinopathy. Hypertensive changes in the retina can be classified from grades 1 to 4. Grade 1, silver wiring, increase in the light reflex of the arteries only. Grade 2, grade 1 plus arteriovenous nipping, indentation of veins where they are crossed by arteries. Grade 3, grade 2 plus flame-shaped hemorrhage and cotton wool exudates. Grade 4, grade 3 plus papilloedema. Here you have an example of cotton wool exudate. An illustration. Now I'm going to read the exercises of chapter 19. 19.1. Complete the table with words from the opposite and related forms. Verb accommodate, noun accommodation, adjective accommodating. Verb constrict, noun constriction, adjective constricting. Verb converge, noun convergence, adjective convergent. Verb dilate, dilation. Noun dilation, dilation. Adjective dilated, dilating. Verb droop, noun droop. Adjective droopy. Verb oscillate, noun oscillation. Adjective oscillating. Verb react, noun reaction. Adjective reactive. 19.2. Match the pictures 1 through 16 with the conditions A through F. Look at the opposite to help you. The first one is drooping of lids. The second one is irregular pupil. The third one is dilated pupils. The fourth one is constricted pupils. The fifth one is cataract. And the sixth one is squint. (19.3) Complete the extract from a textbook. Look at the opposite to help you. Retinoscopy. Examine the retina with an ophthalmoscope, if possible with the pupil dilated to obtain the maximum view. Look for papilloedema and for flame-shaped hemorrhage and cotton wool exudates. Assess the state of the retina and note the presence of narrowing as well as nipping at arteriovenous crossings. So those were chapters 18, the endocrine system, and chapter 19, the eye, the theory and exercises. Thank you very much for watching this video. My name is Emmanuel Cruz Carrasco. So that was the video.